So good evening students. Today we are going to discuss about stakeholders in healthcare system. So today we will discuss only one stakeholder, which is healthcare provider. And what we are going to find out first, what is healthcare system? What is stakeholders? What is the meaning of stakeholders? And healthcare providers, the functions of healthcare providers. What is healthcare provider? So let's talk about first healthcare system or health system. So health system is the organization, process, or a institution through which health treatment is delivered to the people. It's called health system. And also what we call other one. In other definition, we can say that health system is a place where each and everyone can have a health treatment with ease, and the treatment is available on 24/7. So this we call healthcare system. Next we have healthcare provider. Healthcare provider is one of the stakeholder. Healthcare provider are those people who is delivering health to the people. They are professional, they are educated in their fields, and also they provide health education in the society, in the village. Now let's talk about stakeholder. Stakeholder is a person, group of people, organization who can affect and can be affected by any kind of health policy and health program. It's called stakeholder. So today we will talk about one stakeholder, which is healthcare provider. And before talking about healthcare provider, we have external, internal, and interface stakeholders. External stakeholders are those who are indirectly attached with the organization. Indirectly mean to say they are not directly involved during the health making process, implementation of health program, but they can affected by that health policies, by the health programs. Like we can talk about the patients, government, outsider, consumers, all are the outsider stakeholders. Inside the stakeholders we have the policymakers, the management, and organization. It's all comes under the internal stakeholders. And interface stakeholders are those stakeholders who are involved in implementation of any kind of health program. Like we have medical staffs, doctors, physicians. These are all interface stakeholders. So let's talk about healthcare providers. In healthcare providers, the first is physician. Physician have a direct health treatment. Physician give direct health treatment because they have the direct link with the patient. How come? Because patient is here, they discuss with the doctor understand his problem, and he give medicine. Direct link. And in other words, physician or doctors can reduce 60 to 70% of cost, hospital cost, because doctor is the one or physician is the one who confirm that what type of medicine patient is going to have, and if patient is going to admit, in which ward the patient is going to admit, how many days patient have to be in the hospitals, what type of medicine patient is going to take, what type of test the patient need to go through, and when the patient have to stop the medicine. Everything is controlled by the doctors. That's why 60 to 70% cost the doctor can hold, hospital cost. They can minimize, they can extend. It's depend upon the doctor capabilities. Second, we have a paramedical staff. Paramedical staff is also work as a health providers, because like patient have to go through loads of blood test, through which the doctor can understand or diagnose the patient properly. Third, we have the staff nurses. Staff nurses is also the healthcare provider, comes under the healthcare provider. Simple definition of staff nurse: the person who give the first treatment to the patient. It's called staff nurse. Now, furthermore, we have trustees, board of directors. They are also linked with the organization during what we call sorry, health planning or health planning process, or during the implementation process. Now, last one, we have non-government organization, NGOs. NGOs is also work as a healthcare provider, or in other words, we can say community healthcare provider. Community healthcare provider. How come? The main function of NGOs is just to collect